Welcome to Duke Spine Institute live spine surgery, streamed on multiple platforms, including YouTube, X, Twitter, LinkedIn, and others.
Kick and Instagram.
There we go. I'm Dr. Duke Majan, CEO and founder. This patient here comes from Canada to Florida for treatment of his back pain. He's had already fusion done elsewhere in Canada, and you can see the screws and rods on his x-ray. We're going to see that in just a moment. He's got cages in the bone, in the disc. I used to do those surgeries all the time. I've done 1,000 of them on people's backs. And we stopped doing them because it's unnecessary. All that is unnecessary. All we have to do is get in with the laser and fix the disc. It takes 30 minutes per disc and much better procedure. All right, we ready? I'm going to get started and I'll keep talking. But in the meantime, Henry, there's about 30 things that cause chronic back pain. Let's share those 30 causes of chronic back pain with our audience. I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies. With trauma, can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. Welcome back. We are just now getting into the L5-S1 disc. Just about there. Hold on. AP. So our patient has really big hardware, screws, rods. One thing I'd comment about the hardware is the surgeon did not do a very good job of fusing him. If you look at his lateral view, it's very straight at L3-4, L4-5. There's no curvature, and you need curvature in the spine. Hang in there, we're almost done. Where do you feel that?
Where you feeling that pain? Where you feeling that? Where? In your back or leg? Back.
Shot. Are you having any back pain right now? Good job, Berners. Very difficult case, folks, because of the fusion, because of the high pelvis, iliac bone, because of the enlarged facets. It's amazing that I actually got here. Are you having any pain?
You have any pain right now?
How bad is that pain on a scale of 1 to 10? What's the highest it goes?
0 to 10, how's the pain? Give us a number.
How high does it go?
9? 9.
Is that where you get your back pain? All right, great news. He's got 9 out of 10 pain, and that's where he gets his back pain. When you wake up, we'll be done. We just verified that that disc is the cause of your pain. So for those of you watching, Jordan, show us the tear on that disc. There's a huge tear in the back of L5-S1. Circle it. It's all the dark material right where Jordan is circling. Normally, the dye, which is the dark material, should be right where Jordan is showing you. Show the full cotton ball. Thanks. So Jordan is showing you the normal place for the dye to be. But when it leaks backwards, that's the tear. That's where his pain comes from. That was discovered here at Duke Spine Institute. He has painful L5-S1 disc tear. We just verified that with the discogram. Shot? All right, now we're going to go and we're going to repair that disc. When we're done, we're going to fix his facets, his SI joint, and his piriformis. Okay, good job, Jordan. Good job, Berndes. Any questions?
At this moment, no current questions.
Let's show the audience how a disc injury like the L5-S1 disc can be so painful. And I want you guys to know something. Fusion, like he had, very painful, very long recovery, and it leads to more problems like this, adjacent segment disease. Don't get fusion. Don't get metal put in your spine. Don't get stimulators. This patient did not know about us when he got his fusion done. He found out about us from friends. And once he found out about us, he came here and we're fixing him. Num num. All right, let's show the audience how it is that a disc injury can be so painful.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You can see from the video that the way a tear causes so much pain is through inflammation. And the inflammation is actually within the tear in the back of the disc. That's what this patient has. He had a fusion done at L3-4, L4-5 in Canada. He's from Canada. He had a friend from Canada, or family member, who had surgery here, and we fixed that person with laser, minimally invasive, outpatient, small incision, Band-Aid, and the patient said, you know, I'm in pain, this fusion didn't work, I'm going to go to Florida and have Dr. Duke fix my back. So here he is. AP, we are about to pass the dilator into the disc at 5-1. Go ahead. We'll take any questions, and if there are none, we're going to show you exactly what this laser surgery does to repair discs.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from the animation that we are using the endoscope to find the tear and herniation in the back of the disc. That's a painful tear. We're then using the laser to clean it up and remove all the scar tissue, remove all the herniation that's causing back pain. Back pain used to be considered uncurable. Now, at Duke Spine Institute, it's curable. We can cure 99.5% of back pain. We just have to diagnose the source, and we have a treatment available for each cause. All right, no questions?
So we do have a question coming from Mary on YouTube saying,
Hi, Mary. Welcome to our live stream.
saying, good afternoon, doctor.
Good afternoon.
I had my first car accident in 2023. Can you explain the sacroiliac joints and hips, please? I had those steroid injections on Friday. No relief. 22 months. I can't walk, sit, or sleep.
Well, my friend, first of all, you need the right diagnosis, and you're not getting it. And I apologize for that. But you're not going to get the right diagnosis unless you go to the right place to get the right diagnosis. Duke Spine Institute can give you the right diagnosis, and I can do that usually over Zoom. I'm the one who will meet with you. I'll look at your MRI with you. I'll examine you and have you show me where your pain is coming from. I will also have you push on some areas to see if they're tender. I'm going to take note of everything I see on the exam, and then I'm going to give you a diagnosis, what's causing your symptoms. We don't need to do shots to figure it out. Shots are an old technique, unnecessary, and painful and inconvenient, and lots of problems result from shots, even diagnostic ones. Okay? People can have damage and spinal fluid leak. They can have infections and damage to nerves or blood vessels using those needles. Okay? Especially by doctors who don't know what they're doing, which there's a lot of them out there. Okay? Lots and lots and lots of them. So my advice to you is fill out the form for your free MRI review. We don't charge any money for it. It's free. And I will tell you exactly what's wrong. Okay? Once you have your diagnosis, then we can discuss exactly how to fix it for you. And when I say fix, I mean a permanent fix. Duke Spine Institute is the only facility in the world today in 2025 that offers permanent pain relief with our treatments. It's one treatment. You come in, you get it done. It takes an hour, sometimes a little more if you have more than one treatment, and you're done. Your pain is gone the rest of your life. So we just have to fix everything that's causing pain. And we can tell you everything causing your pain after the MRI review. That's my advice to you, dear. Otherwise, it's just conjecture, and I don't work on conjecture. Something with the scope here, always. Something with the scope. You see it?
No current questions, but we do have a comment coming from Mary once more on Facebook saying, my doc sent MRIs 4 years ago. I have a lot of back issues. My lawyer said I can't come to you. I can't convince my lawyer. He said you are very costly.
Yeah. Well, I'm not costly, sweetheart, but good surgery is costly. I don't know who your lawyer is. It doesn't matter. You don't have to say. But lawyers love it when they send you to a doctor who racks up the bill so that they can get the most money from the insurance company in the settlement, and then they go back to the El Cheapo doctor and say, I know your bill was $10,000, but will you take $1,000? And the doctor says yes. So it's actually a network of scammers. That's what you're dealing with. Lawyers work with specific doctors that will give you a very high bill so that you can get money from the insurance company, a large amount, and then the lawyer keeps probably almost 50% of it and gives you the rest and pays the doctor almost nothing. But those doctors are never going to fix you. They have no interest in fixing you. Your lawyer doesn't want you fixed. So let's talk about personal injury lawyers, and let's talk about patients. So I've been doing personal injury care for personal injury patients like you for about 20 years now. Here's the thing. The lawyer doesn't want you fixed. Because if you go to court after your surgery and you say to the jury, I don't have any more pain, my back pain's gone, then the jury is not going to award you something called future medical costs. So future medical costs are medical costs that you're going to have the rest of your life because of your pain. Lawyers want those future medical costs. That's big money for them. That's where they get a lot of their money from your case for themselves to keep. So they want you in pain when you go in front of the jury. They want you, the patient, to be suffering. They want the jury to watch your face and see pain on your face, that you're uncomfortable sitting in the chair in court, that you can't sit still, that you have to move, you have to get up, that maybe even you're in a wheelchair. That'd be even better. The lawyers, your lawyer, wants you suffering when you go to trial so that the jury will give you the most money possible. Okay? Future medical bills. At Duke Spine, we cure back pain. So when our patients go to trial, they're actually smiling and they're happy because their pain's gone. And the lawyer, your lawyer, will hate that because they won't be able to get the most amount of money from the insurance company when you're happy and pain-free. That is the absolute God's honest truth. That's what he means that we're too expensive. We're too expensive because we cure pain, and they don't want your pain. Your lawyer doesn't want your pain cured. Now, if you ask me, that's a conflict of interest. If you ask me, that's an ethical dilemma for the lawyer. The lawyer should send you to the best doctor to cure your pain, which is us, Duke Spine. But they don't. They send you to shitty doctors that take your money, rack up the bills, and never fix anything. So you, dear, have to make a decision. You want to keep living in pain and having your money, your benefits stolen from you by your lawyer and the crony doctors they send you to? Or do you want to get well and be out of pain and settle your case properly and honestly? That's the question you got to figure out. Duke Spine Institute is all about honesty and integrity. We don't play the scamming games with lawyers. That's why lawyers don't like us. And we cure patients' pain, which they don't want your pain cured. Wish I had a better answer for you, sweetheart, but that's the truth. You're probably best off either switching lawyers, finding an honest lawyer, good luck with that, or getting your money and just coming to Duke Spine afterwards and getting fixed. Great question. I'm so happy you brought that up because that's a very important topic for discussion. Most people have no clue what really happens in these personal injury cases and how their lawyers manipulate the system and game the system with scumbag doctors who just do procedures on you that don't work and could potentially harm you. As a matter of fact, the truth is the lawyers actually want you harmed by the procedure because any kind of harm you get from your treatment just gives more money in the settlement. Remember, the lawyer gets about 40% to 45% of that money. They're going to tell you they only take a third. Probably you heard that, right? A third, a third, a third. But that's not true. They actually take more than a third because they tack on their legal expenses and they have all kinds of legal expenses. So they get legal expenses. They charge you for copying things, for mailing things, ridiculous amounts of money. Paralegal time, paralegal benefits. Anyway, you know it. You're going to find out soon enough. Sorry, Mary.
No current questions, but we do have comments coming from Mary once more on Facebook saying, I won't win my lawsuit because I'm preconditioned for 23 years. Disabled for 23 years with my neck, spine, and back. No court, thank you. You are so right.
Thank you. All right. So this patient, this is amazing. We are inside the L5-S1 disc. Remember, this patient's from Canada. He already had a fusion done in Canada by another doctor. Maybe he had it in Phoenix or in Arizona. I don't remember. But point is, I didn't do this fusion. But look at this L5-S1 disc. It's not healthy. It's damaged, and this disc is causing his back pain. He's also got pain now from his SI joint, his facet joint, and his piriformis. We're going to fix all of them today, but we're just about done with the disc. We're going to end the stream. We're going to come back for a facet SI piriformis stream. So get your questions in. Henry, we've already shown the audience how these disc injuries cause back pain. Have we shown them how the Duke laser disc repair cures back pain?
Yes, we have.
Great. Let's show that one more time because I think it's worth watching one more time.
I agree, of course.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see that the laser is used to remove scar tissue, inflammatory tissue, bad pain nerves that develop over time from chronic inflammation. By getting rid of those pain nerves in the annulus, we get rid of the back pain. By getting rid of the herniation stuck here in the annulus, we get rid of the source of inflammation, which is really the source of back pain. So we're attacking the back pain from two fronts. Getting rid of the pain nerves with the laser. Those are branches of the sinovertebral nerve that grow in this area. And we're getting rid of the source of inflammation and pain, which is the herniation stuck in the annular tear. That's the debridement. Any other questions?
Yes, this is a question and or seeking advice coming from Deborah on YouTube,
Yes.
saying, I've had back pain for over 4 years now. I've had a laminectomy on L3, L4, L5, and injections which failed.
Yes.
After watching you, I know now I do have the piriformis issue on both sides, MRI over a year old. I also have bone spurs and a cyst, which no one seems to want to answer why it's there. Not sure where to start, so you have the most updated information to properly assess me. Thank you.
Deborah, just get your MRI in. I realize it's over a year. It's okay. I can still diagnose you. So get it in. We will accept an MRI up to 2 years old now. So you can do your free MRI review with me on Zoom. Just fill out the form on our website. It's a free MRI review. It's all over the place on the website. Henry will put a link to the MRI review form right now in the description below. And I will tell you exactly where your pain's coming from, and I'll tell you about the cysts and bone spurs. Okay, I'll tell you everything you want to know. I will give you a chance to ask me questions. All right, I see all the inflammatory tissue right there, guys? So wow, you can't see this on an MRI, but boy, can you see it endoscopically. That's all inflammation, red stuff. It shouldn't be red, it should all be white. So that's where his pain's been coming from. Poor man had fusion done, didn't even fix his problem, but it sure gave the surgeons a lot of money. They made bank doing the fusion. Fusion is the highest paying surgery in all of medicine. There's nothing that pays more money than a fusion, spinal fusion. I actually built Duke Spine Institute on money from spinal fusions that I was doing. That was before I realized that spinal fusions were no longer necessary, that laser surgery is going to replace every single spinal fusion out there for degenerative disc disease, degenerative conditions. Of course, traumatic spinal instability like a fracture dislocation is a different story. You still need fusion. But the Duke laser disc repair you're watching right now will replace about 95% of all spinal fusions in the world. 95%. If doctors start doing what's right for the patients, which that's going to be really hard to get to happen. I got about 1 minute left here on this disc, and then we're going to end the stream. We're going to go to the facets and SI joint. Man, this is, it's amazing because when you look at the MRI, this disc doesn't look that bad. It's got bulge, but it doesn't look that bad. And then when you come in here with the laser endoscopically, you can see it's much worse than the MRI showed. That's why I diagnose people clinically rather than radiographically. This back pain is a clinical diagnosis, not a radiographic diagnosis, if you know what you're doing. There is no test that's going to tell me for sure where everybody's pain is from. You got to have experience and knowledge like I do on the sources and the successful treatment of each cause, and that way you build a foundation of knowledge. This is all scar tissue from inflammation. See this? Totally disorganized. It's not the regular crisscross pattern you see of collagen when you're looking at a normal annulus. It's actually very much like cottage cheese. Very disorganized. That's a sign of chronic inflammation. Plus the red stuff is inflammation. So you put it all together, it tells a story. Chronic inflammation is the cause of this patient's pain at L5-S1. Even the fat here is not normal. Okay? Normal fat is bubbly yellow, beautiful. This fat, look at that, it's scarred up from chronic inflammation happening right here. About 30 seconds left. Any other questions?
Yes, we have a question coming from Lanu on YouTube.
Hi, Lanu.
Asking a non-medical question. I know you spent time on planting flowers. Do you ever have bird nesting at your backyard? This happened to me last year.
You know, it's a great question, Lanu. Thank you for asking. So I do. As a matter of fact, it's really funny you asked that question because I've been working in my garden, and because it's summertime now in Florida, there's a lot of mosquitoes, and I've been getting bitten. And I don't like wearing the mosquito spray. So there's a mosquito misting system you can buy where they install these little nozzles that spray chemical, right? And the chemical they spray is actually the best one, in my opinion, is something called chrysanthemum oil, which is the oil of a chrysanthemum flower. And that chrysanthemum oil is going to keep the mosquitoes and the no-see-ums and gnats away from me, right? So I contacted somebody to put the system in to my house, and he told me, by the way, did you know the previous owners had a system? And I said, no. And he said, yeah, they had me remove it. And I said, why? And he says, because they noticed that when they killed all the insects off, that the birds stopped coming and stopped nesting in their garden. And so they wanted me to remove it so that the birds would come back. So it's interesting you say that, but I got tons of birds in my garden, lots of robins in particular. They come and sing to me in the morning. And if I'm not out there early enough, they come and try to wake me up in bed, singing outside my window. So yes, I enjoy the animals out there. I release ladybugs all the time, thousands, and lacewigs, so they can eat the pesky bugs that are hurting my orchids. I'm up to about 1,000 orchids now. And that's what I enjoy doing in the morning, taking care of my garden. All right, we are done with the first disc, the only disc. We're going to move on to his facets and SI. We're going to irrigate a little bit, and we'll be back in a few minutes with the facets and the SI joint. And then finally the piriformis at the end. Thanks for joining us.